My name is Paulina. I'm here to talk about involuntary civil commitment. I want to start with a story about a family that was featured on the Press Herald, in which it's about a family who talks about their son who had a serious schizophrenic disorder. They tried to get help for him. He fought treatment. Later on, he finally was going through like serious delusions. They would lay awake every night listening to him, go through these rants. He wouldn't sleep. Finally, he brutally murdered his mother, and then he was placed under involuntary civil commitment. With that being said, my proposition is that involuntary civil commitment should be at a simpler reach for society to use on mentally ill population. Mental illnesses almost always go underdiagnosed, misdiagnosed, or mistreated. According to the KimFoundation.org, in America, 26.2 Americans, that's 18 and older, that's about 1 in 4 adults, suffer from a diagnosable mental illness. Yet, according to statistics, roughly only half of these individuals are receiving treatment. Mental illnesses like schizophrenia, panic disorder, mood disorder, bipolar disorder, among many that can cause, serious cognitive dysfunctions for individuals that can later lead to self-harm, suicide, and, ultimately harm to others. It's obvious that if 50% of these individuals aren't getting treated for it, then it's either not being taken serious or that it's not getting the attention that it needs. There can be many reasons why a mentally ill person isn't getting the, it's either, like I said, being misdiagnosed or mistreated. As stated in the Psychiatric Times website, diagnostic assessment of psychiatric disorders and their comorbidities meaning like two diseases or two conditions present at the same time in an individual, is a challenge for many clinicians. In emergency settings, there is no time to conduct lengthy interviews and collateral information is often unavailable. In acute treatment settings, patients may be too symptomatic to provide accurate information or to recall important details that would aid clinicians in deriving a valid diagnosis. This is why, in regards to the involuntary civil commitment, this would allow clinicians to spend more time with the individuals, to be able to use alternative ways of treating them, and to be able to take that second look to reduce the room for error. Not only that, having the opportunity to only take one look at an individual could prolong the recovery for them, which ultimately is actually counterproductive for them, right? With that being said, my second point is that mentally ill can be a threat to the community. I want to start with a statistic from the mentalillnesspolicy.org. They said that 1,000 homicides, it's 1,000, I'm going to say that again, a year are committed by people with a serious mental illness. 200,000 individuals with a serious neurobiological disorder are homeless. 200,000. Involuntary civil commitment sure would not solve the problem at 100%, as many may argue, but it sure can help to lower these numbers. Help keep our community safer in the end, and also get the individuals the help that they need. Looking at it at a more zoomed-in scale, the MacArthur study also revealed that 18% of individuals with a psychiatric disorder committed at least one act of violence a year. I just mentioned 26.2% earlier, right? That means more than half, that's about, like I said, 18% are committing at least one act of violence a year. And taking a look at the main opposing issue for involuntary civil commitment, which is questioning the legality of treating someone without their consent or violating their rights, after mentioning these numbers, where do we draw the line between one person's rights and the others? In order to protect ourselves, we must be able to give these individuals the help they need without hitting walls that question whether it's right or it's wrong. And this leads to my last point. Fecalist roles limit society's ability to correct people into treatment. The process for having someone placed into involuntary civil commitment is extremely difficult. One, because they have to make the call themselves, or two, they have to break the law in some way. An article on the American Heart Association said that nearly half of Americans with a mental illness do not seek help. Half of them aren't seeking help. And families are not able to help them because of the legality issues. The Journal of Nervous and Mental Disorders said, evidence from naturalistic studies, as well as the current randomized studies, suggest that involuntary civil commitment may decrease hospital readmission rates and total days hospitalized. In the current study, we have also reported decreased rates of violent behavior, criminal victimization, and arrests among subjects who received sustained treatment. I'm just going back to the family that I mentioned earlier where the son brutally murdered his mother. They also talk about how their son thought they were plotting against him. He refused, like I said, to get treatment. Needless to say, he was never going to make the call himself. A tragedy had to happen for him to be placed under involuntary civil commitment. You know, his mom could probably still be alive if they were able to force him into treatment. You know, with that being said, involuntary civil commitment can give an individual and the people around him a better chance for a normal life. As mentioned before, the studies did show improvement in these individuals, and sure, not 100%. Success rate in most situations is, well, not the case. But involuntary civil commitment can and would improve in some people, which is better than nothing, right? These numbers I just mentioned above can only continue to get larger and larger unless these individuals get the help they need. And if we're taking more into account the legality of whether we're violating his rights instead of the positive effects that involuntary civil commitment can have on these individuals, then we're not coming about it correctly. Okay, thank you.
And may I have your outline, please?
I think the same lot.
That's okay, no, it's all right. Thank you. Say again? Sure, you need to speak from? All right, Paulina, I thought that you ID'd the topic pretty clearly. Your proposition, the phrasing on it is a little less clear than I thought it was going to be. It ended up being a little bit awkward. And I thought at the end of the presentation you have a stronger explanation of what your point of view is than at the beginning of the presentation. And there are a couple of other problems at the beginning of the presentation also. There's not really a preview of what the supporting structure is going to be. And when you get to the first point, it's not very distinctively signposted. And so I'm hearing an argument and I'm hearing evidence that you're presenting, but I'm not exactly sure what inference I'm supposed to get from it. Now, when you get to the second and third points, it's very clear. You did a good job signposting there. I knew what those points were. But you got to help your audience a little bit. Audience, people don't listen as well as they should. And you've got to give them a little bit more roadmap where you're going and how these points are and where they are at any given point. And I thought you did better at that in the second half of the speech than you did in the first half of the speech. All right, the evidence that you cited, first of all, I thought you did a nice job kind of explaining things as you were giving your presentation. I thought that was pretty effective. And you had a good illustration in your attention device, and I like the fact that you came back to it later in the speech to kind of reconnect with the point that you're trying to make. I think you need a little bit more citation of what some of the barriers are to involuntary civil commitment. But you did do a good job showing that mental illness is widespread, that it presents a potential threat. And the question then becomes, well, why if it is that these people are a threat and potentially dangerous, why aren't we doing something about it? And I think you need to have a little bit more explanation. It basically comes down to they're the only ones who can do it for themselves. Nobody else can do it. And that sounds like an assertion. I think you need better information on that point. And there have been changes in the rules. We talked about this a little bit when you and I were talking about the issue, and I think you need to get a little bit more of that into the speech. However, on the stuff about what the advantages of doing that would be, I thought you had some very good information. You cited your sources clearly there, and that worked well. And I thought you did a nice job presenting for the most part. Sometimes you have to look at your notes a little bit more often because you got something that's complicated to explain, but you did a good job for the most part trying to sell your argument to us. And I thought that you, at the end, like I said, I think you made it a little bit clearer what your position is, and that's what you want to do. You want to finish off well. All right, thank you.